what's up, Journey? Here with Dr. Cassetta today. He has been a friend to me, a friend to our Journey community, a friend to the Elmira community at large. Speaking of community, he's wearing his Lover Fighter 5K, the Lover Fighter shirts that were made in honor of Brendan McCarthy. That was another time when our community was Journey strong and pulled together for such an important cause. I remember those ice bucket challenges that we did together. And
that was awesome. That was awesome.
Dr. Cassetta, what have you been up to? What have you been up to? Tell us what's going on with this COVID-19, this coronavirus. What's been happening with you?
Well, we've been isolating like everybody else, but still working. We have never seen anything like this, and I'm sure that we never expected to see anything like this. And so now's a time for us to pull together, use our resources wisely, and just be grateful for what we have and work together. And there's no time, this is not a time for finger pointing, but to work together and help each other to get through this, and we will get through this. Mm-hmm. So, we're here at home this week, and I'm very grateful to have my wife, my children, my grandchildren, everyone's doing well. I have a nephew that's a hospital doctor in New York City, and almost every patient that he sees has COVID-19, every single one in the hospital. It's just a matter of how sick they are. And he became ill about 3 weeks ago, and he had to take 2 weeks at home. And basically after 10 days, he was without fever, and he called and he said, I want to go back to work. They said, get in here. They said, someone like you has already been sick, hopefully won't get sick again. We're not 100% sure of that, but we're thinking that's the way it is. So he's doing better, and he's back at work. And in New York City, where he's working at one of the big hospitals, he tells me that's private rooms, usually one patient per room. And right now they have 4 patients per room, and most of those people are in recliners. They don't even have beds for them. Wow. So the stories that you're seeing in the media, there's a lot of things going around, but that's what I heard from my nephew. Wow. So as far as what's going on here, you sent me an invitation to be in your Fit Buddy challenge, and I said to myself, you know what? I'm doing my best not to become a fat buddy. So when the weather permits, Christina and I get out for a walk with the Scotty dog, and we have seen more people out walking than ever before. And we're trying to use your on-demand workouts and the Zoom workouts that you've provided. And that's just a great way for us to try to stay in shape. So this week I worked from home. Our office has been split into teams so that, if one person gets sick and everyone else has to go into quarantine, then that won't take the whole office out. And I've been telling my patients, I've been telling my patients all along, there's nothing I can do, nothing I can prescribe that equals the benefits of a healthy lifestyle, diet, exercise, and sleep to boost our immune systems and to maintain mental and physical health. And, many people that I'm talking with lately doing virtual visits from home tell me they have trouble sleeping. So, I just thought I'd go over a few tips, what we can do to maintain good sleep hygiene.
Oh yeah, that would be very helpful. We want to talk to you today about just things that people can do to keep their immune system strong. I think that's an important thing for us to do. Also, I think it's remarkable when you mentioned that it's like nothing that we've ever seen. You've been a medical doctor for 33 years. 33 years over at the Guthrie, right here locally. So for you to make that statement, that's 33 years worth of experience. So I just wanted to say thank you for what you're doing every day. Thank you for what your nephew's doing. I'm sure that was a scary time. For him to come down with the COVID-19, and what are you going to do? You don't know. Sure, the older population has had it worse, but there's been some younger statistics as well. So it's just important. So thank you for being on the front lines, and tell us what we can do to keep our immune system strong, starting off with sleep. You already talked a little bit about exercising and eating well, but tell us about that if you could.
Well, I've always talked about sleep with my patients and sleep apnea. And so if anybody has a concern about sleep apnea right now, we're kind of limited as what we can do, but I know you can order some mouthpieces online. This might be a time to give one of those a try. And maybe you could get Dr. Dunn on to talk a little bit more about this on one of his presentations. He does a great job with that.
Great idea. Great idea.
Let me throw some other ideas out there. You should only sleep long enough until you feel rested and then get out of bed. And try to go to bed and get up about the same time every day. And you really can't force yourself to get to sleep. If you can't sleep, get out of bed and then try again. So you should avoid caffeine except early in the day, and alcohol really doesn't help your sleep. Keep your bedroom dark, cool, quiet, and free of anything that reminds you about work or stress. Just keep it out of the bedroom. And try to exercise several days of the week, but not a good idea to do that just before you go to bed. And the other thing that really, since we're all just living a virtual life these days, just avoid looking at your devices before you go to bed. Anything that gives off light, that can make that harder to fall asleep. So.
Oh, that's really good. Setting your room up. I've heard a lot about, reducing blue lights and things such as that in your room, right? So maybe even charge your phone in the kitchen or something instead of next to your bed or whatever. Yeah.
Keep the devices out of the bedroom if you can. So
Okay.
next week I have to go back to the office and see patients, but we're going to be practicing professional and social distancing as much as we can. And what we've done is we've limited our routine appointments, and we're just seeing those people that have an urgent need that we can't really meet online.
Mm-hmm.
And we're offering the virtual visits, and this has really worked quite well. We have a couple of platforms that we're working on. One is called Guthrie Now, and one is eGuthrie Virtual Visits. And patients seem very relieved that, they can see me, I can see them, and I can see all their chart and their meds, and I can order things for them, and I can decide if there's enough need for them to either go to the emergency department or come to the office. And, I think all of my colleagues in whatever group they're in are doing virtual visits, and it's a great thing. It's really a great thing.
It seems like this pandemic has really caused not just, of course, us as a fitness industry. If you told me a few weeks ago that I would be on Zoom so much, carrying out group sessions, I never would have believed it. But it's caused us to step into the future. Will this be something that the Guthrie would continue afterwards to make it easier for patients to, consult with their doctor?
We've been doing this right along, but we haven't really made it a big part of our practice. But the thing that has really helped us jump into this is the fact that insurance companies, I have to give them credit. Very early in this, they said, hey, we're going to bring down the barriers so you can do this type of a virtual visit. We want to keep those people home as much as possible. So they have, a lot of the companies have waived copays. And so they're taking the barriers away that might have been in there for the patients to do a virtual visit. Mm-hmm. And also I can connect with a patient if they have an iPhone or an iPad or a laptop or even an Android, they can do a virtual visit.
Okay. So an important question that I have for you with the people that you're consulting with and whatnot, of course, not with any names, but how widespread is this in our community?
I keep up to date with the Chemung County Department of Mental Hygiene. And while I'm on that topic, I want to tell you that we have in Chemung County, we have a superstar Department of Mental Hygiene. I've been working with them for the last couple of years. And we, in our county, we're very fortunate to have the people that we have and the services that we have in our Department of Mental Hygiene and our county health department. So we really are way ahead of everybody else as far as health departments in New York State. As of this morning, I looked at the numbers. 25 patients are positive in our county out of 460 tests, which works out to about 5%. And remember, most of those people that were tested had symptoms. So there are a lot of people out there with either minor symptoms that don't get tested or no symptoms at all. And most of the people that have symptoms, as you know, have concerns about cough, fever, shortness of breath, and chest pain. But lately we're learning more that people can present with unusual symptoms. Even some doctors that I've heard from, just heard from a doctor yesterday that presented with a red eye, conjunctivitis was his main symptom to start with. We've heard about people that have loss of their sense of smell. And some people come in with nausea, vomiting, abdominal pain as a presenting symptom. So this is a highly contagious disease, and we know that there are asymptomatic carriers that can transmit the disease to other people. And I told you the number of people in our county, 25 positive tests. Well, we know there's a lot more people out there that are positive. So really, everyone should kind of assume that if they see someone else on the street, in the store, that that person could potentially be an asymptomatic carrier. And, you know, that's the way we need to behave, that everyone could be an asymptomatic carrier. So we do have some testing available, but the testing is only for patients with fever, cough, chest pain, shortness of breath, and symptoms. And you can call whatever medical facility you go to, and they'll tell you whether you meet the criteria to be tested. Right now, Chemung County Health Department and everyone is working to make testing more available. The emphasis is on getting a rapid, reliable test that can be self-administered. And the reason why that's so important, right now, if you go to get tested, even if it's a drive-through test, a person has to have PPE on, a complete suit from head to toe, with a mask and you know, the N95 and the gown, the gloves, everything. And all of that stuff has to be thrown out after each person.
Wow.
So what we really need is this test that can be self-administered, and it preferably just a nasal swab rather than the one that's going all the way to the back of your nose, which is the way it's done now. And there is a test that's been approved, and it's called the Abbott ID Now. And fortunately, we have 18,000 of those machines already in widespread use doing strep tests and flu tests. The holdup is 50,000 test cartridges can be produced every day. We need way more than that. So the demand of those tests on the test cartridges is way more than what they can supply. And we don't even have one of those machines locally that I know of. So it's coming, but it's not here yet. The next thing that we need is this antibody test. Okay, so the rapid test is to say, are you infected? The antibody test, which would be an IgG test, would tell us if someone has immunity. And the belief is that once this IgG antibody becomes positive, immunity has developed and that person is no longer contagious and can go back to work, taking care of patients without concern that they're going to contract the disease or spread the disease. And then the next test beyond that is create a vaccine to protect us from future outbreaks.
Okay, so that the test that just basically determines that somebody has this immunity, that's based on the belief that if you've had it and overcome it, that you would then be immune to it, right?
Correct, and that's kind of the same thing that the vaccine would do. The vaccine would stimulate production of antibodies. It would almost simulate an infection. That's the way our current vaccines work. So what are we telling people? Distance, stay at home, that's your best defense. If you go out, practice social distancing, good hand hygiene, and it's reasonable to wear a mask, even a homemade mask, even one of these, okay? And the CDC finally came out yesterday and said, hey, maybe everybody should wear a mask. And the belief is that wearing a mask will protect others. If I'm an asymptomatic carrier, this will protect others from me spreading the disease to them. So I wear this to protect you, and you wear it to protect me.
Yes.
And please save those surgical masks and the N95 for the medical professionals and the first responders.
Boy, that's a great concept too. Not just wearing the mask to protect yourself, but wearing the mask to protect others in case you're an asymptomatic carrier. What do you think about the gloves that people are wearing in public? Because I mean, I think that you would actually need to be very cautious about how you would take those gloves off if the gloves were going to do you any good, right? Because if you're touching surfaces with the gloves and then you're still touching your face with the gloves, and then later you use your hands to take off the gloves, can you talk a little bit about the people that are walking around with gloves, and if you're going to use gloves, maybe how you should use them? Because I see some problems with that, as I just described.
Maybe the best thing about gloves is that it's going to remind you not to touch your face. Okay. I mean, if you go to, let's say you go to Wegmans and you sanitize the handle and you sanitize your hands, I mean, you're going to be touching a lot of things. Yeah, if you have gloves and you can wear the gloves, you're going to have to remember to take them off, and there's a proper way to take gloves off, and you can look that up if you're curious, so you don't spread any disease. But again, we're facing a time when gloves could be relatively scarce. Mm-hmm. So I think if you really want to use gloves and you have access to them and you need them to protect yourself, it's okay. But certainly the hand washing frequently and don't touch your face and maintain your distance, those are the most important things.
Now, you mentioned a few symptoms earlier, and I know that you're very busy right now, so I'll only take a little bit more of your time, but you mentioned a few symptoms earlier. And I think that everybody right now that gets a sniffle is like, oh no, am I coming down with the coronavirus? And that wasn't one of the symptoms that you described. You described a cough, you described a fever. You did describe, though, that somebody nauseous and vomiting. So it presented in a variety of ways. But what are your thoughts? If somebody wakes up tomorrow and is like, well, I'm feeling a little congested, or, congested nasally, or, because this is that time of year when it's a change of season. There's a lot going on,
I got to give you credit, Travis. You picked up on that. You're paying attention. You picked up on it. You're sharp, man. You're sharp. But, this is a moving target. What was true yesterday might not be true tomorrow. But the last time I heard about this, that a runny nose, probably not coronavirus, okay? But if you have other symptoms, loss of smell might be. The other thing that really jumps out at me is that when I talk to somebody, I ask them, did you ever feel like this before? And the people that I have talked to that have been tested positive, they almost universally tell me, hey, I've never felt like this before. So if you get sick and you have questionable symptoms, but if you can really say, wow, I never felt like this before, and you have some of those symptoms we talked about, I'd be a little more concerned. On the other hand, I just talked to a lady yesterday who says, hey, I'm having some trouble breathing. And I'm like, wow, that makes me very concerned. She says, hey, I have asthma. This time of the year, I always have trouble breathing. I said, okay, that puts it in perspective. So make sure you stay vigilant and watch for the other symptoms. Or if you feel like, hey, I'm not doing well, or if you're getting worse, let's get you tested. So you got to really use your judgment on some of these symptoms.
Yeah, so I guess that's a great litmus test right there. Do I recognize this? Do I recognize this feeling? Because some people do have that recurring colds or whatever that they get. And if it feels like a normal cold, it could be. However, if you start to get a dry cough, trouble breathing, a fever, and you're feeling well, this doesn't normally come with my cold, let's talk about it. Let's get it tested then, right?
Well, and I think anybody that has symptoms, until you're really sure, the safest thing is to really stay isolated for a while. What I'm hoping is that we'll have more widespread testing in the near future, so that somebody with some symptoms that they're concerned about could come and get tested easily and quickly through a drive-through test or a self-administered test, something like that. So I think we're going to get there soon, but we're not there yet.
Okay. All right. So speaking of where we're not to yet, we have many shutdowns. We are being told to stay at home and basically self-quarantine. You're on the front lines. Do you have any predictions as far as maybe when we'll see a peak, maybe we'll start to get on the better side of things? You got your tongue out. I love it. Stay in Journey strong right there at the office or wherever you are. I love your virtual background today. So I'm going to ask you to speak to two things. Tell me about your virtual background, because it's like I get to interview you in front of the Golden Gate right here, and then tell me if you see a timeline on this. You know, little thoughts for our community. You know, maybe.
Well, the virtual background is probably a lot more interesting than what you would see if you saw where it was. Although I have to thank my wife because I hijacked her little private space in our house, and she has allowed me to use that for my office for the time being. As far as the timeline, I mean, we have projections and we have models, but that's what they are. And, you know, when you watch the news and somebody says, oh, look at that prediction, it wasn't accurate, or, you know, we don't really know. But I guess what I'm thinking is April's going to be a long month, and we should be prepared to stay pretty well isolated through the month of April. And even if some businesses or places open back up, we still need to be very vigilant going on for months really. So even if we start getting out more and doing more, we still have to practice social distancing and hygiene really probably for months.
Yes, like based on the timeline of China, some say that life is starting to return to normal over there. And of course we have some advances that they didn't have to their benefit, you know, as far as just the things that we're working on, like closer to a vaccine. Maybe there's some studies coming to us whether or not certain treatments have been effective. Any thoughts on like, you know, we kind of have a somewhat of a return to normal, and then we have like a real return to normal, right? Like, you know, just whatever that new normal is, you know, would you predict, you know, any prediction?
There is going to be a new normal. Things are not going to be the same. In some ways, I think things are going to be better. I think this has brought out the best in a lot of people.
Yes, it has.
And so in some ways, I think we'll be maybe a more considerate, kinder, gentler society is what I think we're going to see from a lot of people. So
that's awesome.
That's a very good thing. The timeline, I mean, who knows? Who knows?
That's right. Yeah. Well, I don't expect you to have a crystal ball or anything like that, but I really appreciate your time. Anything else you'd like to share with the community before we close out?
Yeah, sure. I mean, I really want to say thank you to you and Cindy and all the coaches. I mean, I talked earlier about how diet, exercise, and sleep are really the best things that most of us can do to stay safe and boost our immune systems. And you have helped so many people in the community to get in better shape than they've been in years. And you give dietary advice, and we have made new friends, and we can continue to work out and stay in touch with each other virtually. And we can use the on-demand workouts at any time. Or if you really want to feel like you're participating, you can jump into a live Zoom visit, and the schedule's posted. So yeah, I want to really thank you for all that you've done to create that and keep us connected. And you know, this is probably the toughest thing that most of us have ever been through in our lives. But at this, you know, I really think it's time to think about what do we have to be grateful for. I mean, you know, every day try to think about something you're grateful for. And if you see someone that is doing a good deed, express your gratitude to them. If you get the opportunity to help someone out, please do. But you know, don't forget to stay safe, social distancing, hand hygiene, all that. It's a great time to use all this technology to stay in touch with your family and friends. And you can, even though your church services have been canceled, most of the congregations are having live streaming, so you can connect with your church family with live streaming. And you know, like I said, we're going to get through this, and hopefully we'll be better and stronger as a result. And I saw a post a couple days ago, and it said, remember, you're not stuck at home, you're safe at home. So just put things in perspective and be thankful for what you have.
Well, thank you for your kind words about Journey. You know, you've been a great supporter since the beginning, and you're just an awesome part of our community. Thank you for how on a regular basis you just give of your time to our members and the community. And I do believe that this is making us better. There are things that we just didn't have at Journey before that we're now able to do for people. Cindy and I are doing live cooking shows and trivia, and we have those virtual workouts, and we're staying Journey strong. And thank you for giving us the information that we need to stay Journey strong. And I think you have some great advice there. Cindy and I finished our sessions today, and we stayed socially distant, yet at the same time, we put our focus on somebody else. There was somebody in our community that had a loss and that they needed us. And so, we were able to, pick up a card and, drop it off and, then that way they know. And I think that's really important, that we put our focus just beyond ourselves. If you find yourself stressed or depressed or anxious, just look outside yourself and say, maybe I can just send somebody like a positive message, and then you'll feel positive, right? Or a comforting message, and then you feel comforted. You just can't help somebody else without helping yourself. And that's one of the true joys in what we both do. So,
Absolutely. Absolutely.
Yeah. Well, thank you for your time today. Really appreciate you.
Thank you.